I'm a consultant rheumatologist and one of the founders of London Osteoporosis Clinic. Just wanted to share with you some of our thinking and the approach that we take to the patients that we see in clinic, and the basic framework that we look to use for our patients is really about trying to get them to be symptom-free, get them to be drug-free as soon as possible, and then ultimately to be doctor-free. So our aspiration is for the patients to be symptom-free. As you know, when any of us has any symptoms, it impacts our ability to be able to function and to be able to do the tasks that we need to at work or otherwise. This then has an accumulative effect in terms of the loss of function. There's often loss of activity and muscle wasting. Has other consequences. Some conditions can lead to reduced life expectancy in themselves, or the complications developing from those conditions. So we feel that the minimum focus for our patient has to be that they need to be symptom-free. To continue to have symptoms, it continue to impact on them, and more importantly, many of the conditions, pain, otherwise, if they're not treated immediately and comprehensively and completely, they can become chronic, and then they can have other consequences and impact. And we're all learning lots about the issues with chronic pain and addiction to opiates and so on. So some of those situations could have been avoided if the underlying issue resulting in the need for pain relief and opiates was treated in a timely way and led to the resolution of the underlying cause for the pain and prevent the need for ongoing medication and then the dependency that develops subsequently. The other aspect that we want to emphasize is for patients to have whatever treatment that is necessary. We take a holistic approach, so drugs have a role to play, but we look at more nutrition, exercise, other modalities of treatment, and to give options for patients to be able to help themselves and prevent issues from developing in the future. But we do want the patients to be treatment-free. We want them to be drug-free and free of their symptoms. And then ultimately, we want them to be free of the clinician, free of the need to go and see clinicians or clinics or healthcare professionals for the control of their symptoms. They should be drug-free. So ultimately, we want everyone back to normal, doing their activities and tasks and their family and their work and so on, and free of the underlying condition. And so we aspire for patients to be symptom-free, drug-free, and doctor-free, and only then we have a sense of achievement and conclusion. And until then, we are striving to get every individual that comes to our clinic to that state. Do please have a look around the website. There's lots of information. There's lots of preventative stuff. If you have any questions or issues that you want to discuss, do please get in touch with the office.